Hello, everyone. Welcome to the final video in our Lifestyle Medicine webinar series. We've hosted this 6-part series exploring strategies using tools from lifestyle medicine to improve health and well-being after a diagnosis of cancer. We're thrilled that you've joined us today for this important topic. Just to give you a little background about the Lifestyle Medicine program at the Mass General Cancer Center, this program is available to all patients who receive their care at the Mass General Cancer Center. Our program provides evidence-based lifestyle interventions that can improve quality of life, alleviate symptoms after treatment, and promote the adoption of healthy lifestyle behaviors after a diagnosis of cancer. We provide personalized consultations, and we also offer group visits. This webinar will focus on strategies to manage fatigue using tools from lifestyle medicine. And at the conclusion of the webinar, we will have an opportunity for Q&A. So it is my honor to introduce our speakers. We have 3 great speakers this evening. First, Kristen Baglini is a gastrointestinal medical oncology nurse practitioner with a specific research interest in how chemotherapy affects each patient's ability to engage in exercise behaviors during treatment for their cancer. Next, Rachel Milstein, PhD, is a clinical health psychologist in the Lifestyle Medicine program. Her clinical and research interests focus on health behavior change and coping with cancer and other chronic illnesses. Finally, last but certainly not least, Kirsten Anderson is a wonderful social worker who works with us and focuses on oncology, and she is based at the Mass General Cancer Center at Newton Wellesley. Her clinical focus is centered around the intersection of mental health and medical care, specifically coping with cancer and other serious illnesses, with an additional interest in integrative therapies to support post-traumatic growth. So we're so grateful to all of our speakers for joining us, and we will let you take over. Thank you for joining us tonight.
Thanks so much, Amy. I'll go ahead and share my slides. All right, just want to make sure everyone could see these, or at least the panelists. Good. All right. So as Amy said, today we'll be talking about lifestyle strategies to help improve fatigue. We'll get into a lot of different sort of topics. As far as sort of the outline for what we'll talk about, first, the background of, what is cancer-related fatigue and what causes it. We'll go into ways to think about fatigue, as well as what are potential interventions to help minimize fatigue. From there, we'll go into talking about fatigue theories. Kirsten will talk about this, and then Rachel will go over an ACT worksheet activity. And finally, we'll have a bit of a patient perspective. All right. So this slide just really defines fatigue as it relates to cancer and treatment. We know that fatigue can significantly impact quality of life. The cause of cancer-related fatigue is not entirely clear, but between 80 to 100% of people with cancer report experiencing fatigue. Fatigue is often the most distressing side effect from cancer treatment and tends to have a more negative impact on quality of life than vomiting, nausea, pain, depression, a lot of things that we think of as associated with cancer and cancer treatment. There are many factors that contribute to fatigue. Some are fixable, while others may take time or never really improve dramatically. For many people who experience or have experienced cancer, fatigue often lessens or stops when treatment ends, but symptoms can extend years into survivorship. So, this is just sort of a diagram that shows all of the factors that can play into cancer-related fatigue. And as you can see, there's many cancer-related and many that are sort of unrelated, but do certainly play a role and have a sort of place as a background in overall fatigue levels for patients, even out from cancer treatment. This is a sort of a diagram of the mechanism of fatigue. Again, there's many causes, but as it relates to cancer and treatment, fatigue is the most common adverse effect. Inflammation is a key mechanism of cancer-related fatigue. Cytokines, which you see on the left there, are these sort of molecules that are crucial in controlling immune and inflammatory pathways in the body. And they typically increase in response to cancer treatment, in response to infection, tissue injury, all of which are very common things that people with cancer experience. There's also these host factors, again, a number of other factors outside of cancer that increase the risk for fatigue, many of which were on the previous slide. And as you can see, there's a little bit of a feedback cycle here where, if you're undergoing treatment or have cancer and increases these inflammatory markers, can lead to fatigue, which can actually worsen some of your other chronic conditions, whether it be directly or through limiting how much you can do on a daily basis. We know that exercising and staying active and following a healthy diet can be difficult when you're fatigued. And so that can actually impact other risk factors. And so it's a bit of a feedback cycle. So now that we've sort of looked at the mechanisms, let's talk about some of the effective interventions. First off, I want to mention you should work with your multidisciplinary oncology team on best ways to manage whatever symptoms you do have, since these can all contribute to fatigue and affect quality of life, including pain, nausea, and sleep disturbances. And so sleep disturbances, to try to manage that, for patients with insomnia or other sleep disturbances, specific measures to improve sleep hygiene should be taken. These can include cognitive behavioral therapy, CBT, medication, and referrals to sleep specialists. Exercise, which is probably one of the most common things we talk about. So the first thing to do is make sure you're medically cleared, and we'll talk about this in a bit, for exercise by your physician, since certain conditions can be a safety risk. Once you are cleared, we typically recommend an individualized program of moderate aerobic exercise for most patients with cancer-related fatigue, both during active treatment and for those who've completed treatment. Guidelines from ASCO, which is the organization for making many of the guidelines for cancer patients, for management of adult cancer survivors with fatigue, recommend about 150 minutes of moderate aerobic exercise per week, such as fast walking, cycling, or swimming, as well as an additional 2 to 3 strength training sessions weekly, which would be weightlifting or any sort of resistance training, whether it be resistance bands, body weight exercises, things of that nature. Walking programs are generally safe for most cancer survivors. Patients can begin this type of program after consulting with their doctors without any formal exercise testing. Regardless of the limitations, all trials that have been done in looking at exercise have demonstrated significant benefits, namely less fatigue, less emotional distress, decreased sleep disturbance, improved functional capacity, and better quality of life for moderate exercise in patients with cancer. Mindfulness-based approaches. For cancer survivors with persistent fatigue, we typically recommend mindfulness-based approaches such as mindfulness-based stress reduction, cognitive behavioral therapies or CBT, art therapy, and awareness practices. Yoga for cancer survivors with persistent fatigue, and for certain patients on active cancer treatment, we suggest mind-body approaches such as yoga. This should be scaled to your experience and fitness level. Acupuncture. Some studies do suggest acupuncture is both safe and effective in decreasing fatigue levels in patients with cancer-related fatigue. Psychostimulants or prescription medications that can help certain people with certain types of fatigue, which are not ideal for all patients, but something you would talk to your physician about. An important thing to sort of keep in mind throughout all this is that, similar to treatment for any disease, not all interventions will work for all people. Some of the interventions will work for many people, but the improvements in fatigue will be very incremental, or you may not have much improvement at all. Sometimes there's really very little that can be done, or you'll need more time away from cancer treatment, what we call a tincture of time, to recover. In situations such as these, it is important to set expectations around your energy levels and to do your best to prioritize the things that are most important, which we'll talk about in a bit. This slide summarizes the evidence for exercise. Like I said, we like to talk about this a lot in improving various health-related outcomes for patients with cancer. You see there is strong evidence for exercise in managing cancer-related fatigue. It also helps with mood and sleep, both of which we know can affect your level of fatigue. So there's likely a combined benefit for exercise. As we talked about the recommendations here, generally 150 minutes of aerobic exercise and 2 to 3 sessions of strength training a week. The general consensus is really to do your best to avoid inactivity. Adhering to the 150 minutes can be quite a daunting task for some people. So avoiding being inactive or avoiding, just periods of not doing anything can be really a good goal when that's where you are fitness-wise. This is a goal that just talks about sort of getting started and how to sort of set a plan. So keep it simple. Like I said, avoid inactivity. If you get moving as soon as you're diagnosed, you'll feel better. Walk to the mailbox, walk to the dog, little things like that, things that you wouldn't often think of as exercise are exercise if you use them and sort of look at it that way. Talk to your doctor, your healthcare provider before starting a new exercise program. Are there any limitations, safety considerations, things of that nature? Expert support. Your local hospital or wellness center may have a structured program. Things like the Y do have programs as well. Certified cancer exercise trainers, physical therapists, other members can lend a lot of insight into this. And then keep a daily log of your exercise, fatigue, medications, treatments, which can really help you to sort of learn what may affect you, learn what helps, and help you to individualize your own program. Finally, I'll end with this visual, which Kirsten found. Your journey is really about the direction in which you're heading, not the speed or the pace at which you're going. None of this will happen overnight, and both you and those around you should keep in mind that incremental progress, like I said, is what we're really aiming for whenever we can. Perspective is definitely important, and with that, I'll let Kirsten talk about some theories that will sort of help to understand the ways to visualize fatigue in your day-to-day life.
Great, thanks, Christian. Perfect. All right, so ways to think about fatigue. When you know your energy is finite, you have to start thinking differently about how you optimize energy and prioritize tasks. These frameworks that we're going to go over can help you think about energy in a more concrete and tangible way. And from there, we can start to identify which activities, tasks, people drain our energy versus which replenish our energy. This allows you to take back control as you think about how to plan your day and set yourself up for success. So on this slide, we talk about the spoon theory. So this was created by Christine Miserandino, who wanted to explain to a friend what it was like to live with chronic fatigue. And she utilized a handful of spoons to demonstrate to this friend how she lives day to day with a limited amount of energy. In her case, she started off with 12 spoons. She explained how, when you are healthy, you expect to have a never-ending supply of spoons. When you are living with cancer-related fatigue, you need to start thinking about how to plan your day. And to do this effectively, you need to know how many spoons you are starting out with. It's also important to remember that the number of spoons you have can vary from day to day, depending on how well you slept, whether you're sick, or whether you're feeling depressed. And each task uses spoons, sometimes 1 spoon, sometimes 4. Once you use up your spoons, you're out. And so this framework really encourages you to start noticing how many spoons you have each day and offers a visual for understanding what it takes out of you to do everyday tasks. When we have this level of awareness, we can begin to plan and prioritize accordingly. This framework also offers you language for talking about fatigue with loved ones in a way they can start to understand. For example, I don't have enough spoons to go out to dinner. We'll go to the next slide. So another way to think about fatigue is the gas tank metaphor. So perhaps before cancer, you were driving a car that got very high mileage per gallon. Perhaps you could drive for days on end without needing to stop for gas. Rarely would you ever find yourself in the position of realizing your tank was empty and that panicked feeling of needing to find a gas station. Now, after cancer, you're driving a car with a much smaller tank. You can only drive so far before you need to fuel up. You might need to make several pit stops in a day, or you might plan on taking shorter trips to avoid the need for multiple stops. You have to start consciously mapping out which route you want to take, what other trips you have planned for the day, how to be most efficient with your fuel, and to know where the nearest gas station is. Similar to the spoons, this framework offers language that can be used with friends and family, as you might explain why you can't always do as much as them. For example, my tank is on empty. This also serves as a reminder to us that rest and refueling are productive, active processes. Many of my patients get stuck in the thinking trap that the decision to rest is lazy and that you should be able to do it all the time, all the way you did before cancer. I encourage you to remember that your car doesn't magically fill up. It isn't a matter of willpower. If your car is on empty, I don't imagine you'll be very successful making the car go just by yelling at it. You need to notice it's on low, identify the closest gas station, get out of your car, pay, and fill the tank. It's the only thing that will allow you to continue driving so you can get where you need to go. And so this brings us to ABC days. So the idea behind ABC days is to set yourself up for success by planning days around your energy levels, not the other way around. Trying to plan a day of high energy tasks when you know your energy is low can lead to feelings of disappointment, frustration, and self-judgment. You can't use spoons you don't have, and you can't drive for 10 hours if you have a quarter tank of gas. Maybe if you go 1 mile per hour, but even then I'm not sure and I wouldn't advise it. You'll see here that A days are the days you feel like you have a solid amount of energy. Your tank is full or close to full. You have 10 to 12 spoons washed and ready to go. On these kinds of days, you'll pick high importance activities that require higher levels of energy. On B days, you notice you have some energy, enough to get out of bed and do a few things, but you want to be careful to not burn yourself out too quickly. This is a good day to plan some lower, medium energy level tasks, even if you have to break them into chunks, and maybe you plan some rest stops along the way. Finally, C days are the days you wake up tired and feel depleted. On these days, the task at hand is rest itself. These days are just as important as any of the other days, as they are what will allow you to have more A and B days. Planning days around your energy levels means it is important to listen to your body and recognize where your energy levels are at. You might start noticing patterns of high and low energy levels on certain days or at certain times of day. Once we've done that, though, the next question becomes, how do you decide what to prioritize? And that's where Rachel comes in.
Thank you so much. So we want to talk now about our energy. How do we decide, as Kirsten says, what to spend it on? So we encourage you to think about your energy sort of using this framework. We're going to talk about goals and values. This is borrowed from ACT literature. It stands for Acceptance and Commitment Therapy. It's a type of third wave cognitive behavioral therapy that encourages us to practice mindfulness and focus on the things that we can do to live a valued and meaningful life. So deep down inside, considering what is important to you. What sort of qualities do you want to cultivate as a person? How do you want to be in your relationships with others? So values are the directions we can always keep moving in. Values are the ways that we want to be and interact and relate with the world, other people, and ourselves. They're leading principles that can guide us and motivate us as we move through life. So values are not the same as goals, however. They say values are directions. So a value is like heading west. No matter how far west you go, you can never reach it. There's no end point to going west. A goal is what we want to achieve along the way. So a goal is like a river or a mountain or a valley we aim to cross while traveling in the direction of, in this case, west. Goals can be achieved or crossed off, but values are an ongoing process. We can go to the next slide, please. So in order to think about this, goals and values from this particular framework, we're going to encourage you to take a few moments. I'll explain this activity. Take a few moments and really think about what you value in your life. So this is a worksheet that will ask you to think about each of these different domains. Each of these represent a value. Certainly, this is not an exhaustive list of values, but it does encompass some of the more common values that people tend to bring up. So I'll tell you how this will go, and then we'll give you some time. In the main part of each large box, consider writing a few keywords or thinking about, right? Since we're all virtual, do whichever works for you. Think about or write a few keywords about what is important or meaningful to you in this domain of life. Thinking about what sort of person you want to be. What sort of personal strengths and qualities do you want to cultivate? What do you want to stand for? What do you want to do? How do you want to behave? And if any of these don't apply to you, that's completely fine. Just leave it blank. And if you get stuck on one, just skip it and come back later. All this helps to do is to identify your core values that may cut through many domains of life. So once you've kind of considered what each value would look like for you, you'll go through and in the upper small square box inside of each box, you'll mark on a scale of 0 to 10 how important these values are to you at this point in your life, knowing that this can change as situations change. So 0 is not important at all, and 10 is extremely important. And it's also okay if multiple squares have the same score. So that's the overview. Think about what you want what each value would look like to you if it applies to you, and then put your 0 to 10 in the top right corner. And then we'll give you about a few minutes to do that, about 4 minutes. We'll come back at 7:25. And we'll ask you some questions about what you notice, what these numbers and these squares tell you about what's important to you. So I'll pause there. And if this sounds appealing to you, feel free to jot a few things down, think this through. If not, just enjoy some kind of quiet time, maybe even some deep breathing. I'll pause here. Yes, great question. I'm happy to repeat the assignment. And in fact, I will put it into the chat. Just a second while I grab this here.
Thank you so much, Rachel. This is such a great exercise. So just Dr. Milstein put in the chat how she wants everyone to approach this. We want to make this interactive, so I love it.
Okay, in answer to the question, think about where 0 is not important and 10 is extremely important. Think about how important each of these values is to you right now. So for instance, if leisure was very important to you, you'd put maybe a 9 or 10, something like that in that top right corner. Okay, let's take one more minute. And then we'll do some reflecting. Okay, so hopefully everyone's gotten a chance to think about these values and which if any are, important or more important or less important. And I'm so sorry, I see that the chat only goes to the host and the panelists. So that's why you couldn't see the chat. My apologies. So the question here is to reflect on what you noticed. What did these values and sort of this mini ranking system, so to speak, what does it tell you about what's important in your life? And you certainly don't have to share at all with us or with anyone else. This is can be just for you. But what it will help you do is to drive the choices that you make in terms of what you spend your energy on. So why don't we flip over to the next slide? Okay, so here we have a priority list, essentially. So what are you going to spend your energy on A days, on B days, and on C days? So if you recall, A days are the days when, we have our 12 spoons, we have all our energy. B days are the days when we aren't starting with all of our spoons, or our gas tank maybe starts at about midway full. And C days are the days that doing the minimum that we can is exactly where we need to be. So maybe spend another minute or two thinking about what you might put into your A days, your B days, and your C days. What are the activities that you consider high, medium, and low priority? I'll just spend another minute or two on this. Okay, so even if you've just gotten a start on this list, we encourage you to consider this framework when you're noticing your different levels of fatigue. So what are those high, medium, and low priorities? How does it fit into your ABC days? And how does it fit in with your spoons or your gas tank? So I'll pause there. I don't know if Kirsten or Christian wanted to add anything at this point, and then we'll go on to our patient perspective.
Yeah, I don't have anything to add. I was going to say maybe there's a way we could link these worksheets after the webinar, so that if people want to complete these on their own time and just be able to reflect on it. And like you said, Rachel, it changes over time. So what is filled out today, next week or next month may change. I think that would be great to be able to maybe link that. Kirsten, did you have anything to add before I move on to the last slide?
No, I think that's a great suggestion to see if we can get these worksheets to folks so they can keep thinking on these things, right? I think now that you know what you're looking for, right, you can start to monitor and track, where is my energy higher? What things really inspire me? What things exhaust me? Who are the people in my life that I always feel more energized talking to? Who are the people that maybe are the energy vampires, as we call them. So just things that you can start to notice in your day-to-day. And I think we have a really great patient perspective to listen to.
Awesome. So I will move on. Hopefully this video does work. So this is just for some pre-context. This is a young woman who was diagnosed with cancer. And she's sort of talking about her experience after the fact with fatigue. Bringing in a lot of perspectives of those around her friends, her family, and talking about a lot of what we've discussed here in terms of trying to make, prioritize what's important in our life, have a value set, and just understand, meeting herself and where people meeting her where she's at. So we'll go through the video and we can talk about it a little bit afterwards.
I never suspected that it would be cancer. I think you just don't in our age group. All I knew was chemo, you lose your hair. So that was the only thing I really expected to happen. My hair was hanging on a bit and it was just really nice. And I was like, maybe I'll be the one person it doesn't happen to, but then obviously it did happen. One moment I was fine and doing whatever I wanted. The next moment they were like, you have to go straight to hospital. I had chemotherapy and surgery. I was sent to the States for proton therapy, which is like a targeted form of radiotherapy. As the treatment carried on, I just got more and more tired. I think about 3 months after treatment finished, I was like the most tired I've ever been. People were so understanding during treatment, but after treatment's finished, it's like, okay, you've had like your time in the spotlight, like now time to move on. When actually like the fatigue got like so much worse. all your friends sleep and then they like feel refreshed and get up and go, you feel like there's a separation because you can't do everything that they do. My consultant mentioned that being active helped, but it was trying to find the balance. I'm quite used to like pushing myself with exercise, but if you push yourself, then it just wipes you out for like the next few days. So I did a lot of running before treatment. The radiation damaged my pelvis, so I can't really run long distances or like run how I want to. So I had to look around for another activity. And I started doing a bit of open water swimming, and I just kind of feel energized and invigorated. I am tired, but it's not the exhaustion that fatigue leaves me with. So I'm going to swim the Serpentine, and I'm kind of just looking at other like open water swimming challenges. Before cancer, I didn't really need to think that much before activities. So I could just kind of go for a swim, go for a run, and then go out and see my friends. But I just have to kind of take a step back.
I didn't realize that fatigue wasn't just like tiredness. It dominated like every decision you had to make. You just gaze off into the distance sometimes. We'll ask you something and then you'll just look somewhere and we'll be like, Ruth, you're not listening. And you'll be like, I'm so tired. Like, I just can't even form my words right now.
Do you think the fatigue is the biggest issue at the moment? Because I'm often asked,
Yeah.
what's the worst thing?
Because it affects me daily, and it means that I can't work full time. And I just feel like I'm almost elderly. So my advice for anyone going through fatigue, make life easy for yourself whenever possible. So that's in terms of getting to bed at a decent hour and making sure you're getting enough sleep, because that definitely helps. Eating well, avoiding like things with loads of sugar, because then you get like sugar highs and sugar lows, which makes everything a lot worse. When you have a bit more energy, just think about how you can make life a bit easier for yourself in the next week or so. I also have like an emergency bit of money just set aside in case I need to get a cab home. Make sure you stand up for yourself. You kind of have to be really explicit and say, I can't do that. And that's with friends as well as employers. Look on websites like Work with Cancer and the Macmillan website. You need to be really clear on your rights, because when you have had cancer, you are then defined as disabled for the rest of your life. So there are certain legal requirements, like employers have to make reasonable adjustments. So I had a kind of a list of things like more flexible hours, being able to go and take breaks, like having a quiet room where I could just lie down. My main manager knows about the cancer and also the fatigue, and they've been really good at working with me to kind of be seen as like a asset rather than a problem. Helps a lot. For parents or like carers to know fatigue is real, and it's so much more than just tiredness. I know with my own parents, I have been guilty of just letting them do too much for me. They ask my sisters to do things instead of me, and I know I can definitely get up and do them. So I usually have to say, actually, you can ask me to do that. But I think it's maybe just having an honest and like open discussion with your child about their fatigue. What do you do to help me with my fatigue?
I think it's just like really practical things. Like, for instance, your birthday, when we took you to see a musical, we were like, we should book something in the afternoon rather than the evening, because she's going to be too tired to do something in the evening. Thinking before I ask you to do something, instead of being like, let's do this. Oh, no, wait, you can't. Let's do this. Oh, no, that wouldn't be a great time. So you don't have to feel like we're going out of our way.
Well, I just worry that you guys are missing out on doing stuff that you want to do, like especially on holiday, when it seems like people want to go and do stuff. And
I don't want to do it without you. That sounds cheesy.
I think completing treatment is like a really mixed bag, because there's so much expectation. This is like the moment you've been waiting for, like in my case, for 11 months. Everyone's really happy, but you're just wondering, like, when will I ever get back to how I was before? And I recently talked to my consultant about it, and she was like, yeah, it can last like your entire life. I mean, I feel like I've kind of been given a second chance at life now. I've finished treatment and I've started to feel like a lot better, and I like moved to London. I'm living with friends. I'm working, and I'm just like quite excited about life.
So I'll pause it there at the end. Just I guess a few thoughts. Every time I watch this video, sort of different things stick out to me a little bit. One thing that I always find really important is making life easy for yourself whenever you can. I think that's something that when you're not fatigued, you sort of take that for granted. The ability to get up and do basic things, to get up in the morning, shower, brush your teeth, get ready for the day, seem like small tasks, but as you know, we talked about there, that uses up your spoons, and that might be one spoon, but it's a spoon that you have for that day. And so making life easy for yourself, whether you say, you know what, I'm feeling good the day before, I'll shower now so that tomorrow, who knows how I'll feel. And giving yourself a chance to just make life a little bit easier. That's one thing. And the other thing is just the openness and honesty with everyone around, everyone around her and her friends, her family, to say, no, I can do this today. I don't need you to ask someone else to do this. I think also empowers her, and it can empower people a bit. And maybe there aren't those days where you feel up to doing those things. Maybe every day you just feel like you want to try and do the things that you only really want to do. But it's really about perspective, and that's where the values and priorities really come in. So like I said, this video I really like, and I think just every time something else sticks out.
Well, thank you all for sharing your insights and sharing this really inspiring video. And I do want to let our audience know, feel free to put questions or comments in the Q&A box or in the chat, and we can now have a discussion about those questions. And actually, there's already a really interesting question in the Q&A box. And Dr. Milstein, I'm going to direct this one initially to you. Like, some days, if you're a parent, you may have those A, B, and C days, but you obviously have to do your job as a parent. And what is your advice for individuals who are facing that kind of challenge?
I thought that was a really great point. So thank you so much for bringing that up. Those are the times when it's actually really helpful to kind of go back to your plan or your values. And so it sounds like, for you in this case, parenting, this is probably a 10 out of 10, right? It's the most important thing. So that'll cost you, X number of spoons. And it's about figuring out what's left, working around the big rocks in your day, right? Let's put that as your big rock. Now let's put the small rocks around it and see what else you have the energy for. If you have 1 or 2 spoons left, is it that you order takeout that day? Is it that you ask a friend to, watch the kids for part of the day, et cetera, et cetera. It's, I think, being really flexible and creative about how you can accomplish the things you absolutely need to accomplish and how you can let go of the things that you don't need to accomplish on a C day, for instance. And I don't know if others had additional thoughts about that.
I think the only thing I would add, I agree with everything that Rachel just said. I also think, looking right, the things that can be pushed to another day, push them. If you can delegate to someone, allow yourself to take that off your plate. You have plenty of other things, I'm sure, on that plate still. And also, modifying tasks where you can. I've had some people, like they have to do if they have to do dishes, washing dishes at the sink, do you have a stool that you can bring, right? Maybe you only spend 15 minutes on a larger project before you take a break. So breaking larger tasks into chunks, right? So, kind of just figuring out, how do I make this smaller and doable without over exhausting yourself so that you're out of spoons for the rest of the whole day. Because, there are things you can do to get spoons back or to refuel your tank, but you do have to build those in, even if they're small things. That's all I'll add.
Those are really great tips. There was another point that she made in the video, which I thought was really interesting, that I think all of us will say, yes, we've heard this from our patients. She said when she completed treatment, she thought she was all done, she'd be back to herself, and then realized that despite completing 11 months of treatment for sarcoma, she really continued to have that profound fatigue. And obviously, based on what she said in this video, is still persistent and obviously very difficult for her to deal with. And that, I think we do see that with our patients, and that's a really hard thing about cancer treatment. I don't know if one of you would like to comment further about that. Christian, do you want to comment? I know you care for patients with GI cancers, and I'm sure you see this all the time in your clinic.
Yeah, I was trying to think of what I would say is the best response. I agree. I mean, I think it is for many people. It's many things, right? It's the unknown of how you'll feel in terms of the symptoms. We often, the question is, well, when will I feel better? And there's no crystal ball for that. And so that can be a huge unknown. And I think it creates a lot of worry and uncertainty, but also the fact that you've gone off of treatment and, you know, feels like doing nothing. And I think that those two things combined can be really distressing. But I do find that helping people to channel energy in the things they can do, which I think is where you find the role for a lot of the things we're talking about today. Yes, they help fatigue, they help symptoms, but I think they also sort of distract and give you a sense of control. So that's usually how I frame it is, you know, yes, we know that you're done with treatment. We don't know how long your symptoms will persist, what the trajectory will look like, but these are the things you can do. And if you do them, you know, we can't promise when or if, but at least you're doing something. That's sort of my take on how we look at that. Yeah.
I agree. It's certainly challenging, and every person's different in terms of their recovery, and so many factors that can affect that. One of them is a great topic that's in the Q&A right now, is asking about sleep tips. This individual says, often I'm so tired, but I have a hard time falling asleep. And we know that sleep is one of the key pillars of lifestyle medicine. We've done webinars on it, which we can link to, but I don't know, Dr. Milstein, if you want to comment on tips for folks who are having a hard time falling asleep.
Yeah, it's such a great point. I'm so glad you brought that up, right? Sleep and fatigue, how closely linked are they? It's everything. So a couple of things. There could be a wide range of reasons for difficulty sleeping or falling asleep, staying asleep, waking up too early. There's different types of insomnia. I might encourage you to talk to your physician if if there's someone that you trust. That's a good place to start, because there are things that we can do to rule out things like sleep apnea, restless leg syndrome, some of the more organic sleep disruptive conditions. If it turns out that it's behavioral, you can think about modifying a lot of different things in your sleep environment, in your sleep routine, to help you sleep. I'm just going to go over some very basic sleep hygiene tips. You can find a lot of this on the internet. You can look into, again, if it's behavioral and not medical, you can look into something called cognitive behavioral therapy for insomnia, which we abbreviate as CBTI. There's even an app called CBTI Coach, which is put out by the VA, and it's actually really quite helpful for a lot of people. But briefly, just very briefly, our bodies are really trainable. So we want to train them to, thanks Amy, Dr. Commander, go to sleep and in particular wake up at the same time every day, 7 days a week, which may sound like, terrible. And in which case, don't do it, right? Only do it if it's going to help. None of these tips are things you have to do. They're just things you may want to try if something in your routine isn't working for you. So the idea is you want to figure out the amount of sleep ideally you would need to wake up feeling refreshed. And that can be a relative term, right? If you're in treatment or if you're kind of experiencing this ongoing fatigue, refreshed will take on a different meaning. But you want to think about how many hours ideally you'd like to sleep. You think about a kind of a natural wake up time for you, and then you backtrack. Let's say it's 8 hours. You want to wake up at 6 a.m., you backtrack 8 hours. You really want to be asleep by, let's say, 10 p.m. Did I do that math right? I think that's right. Then you figure out how long it's going to take you to fall asleep. If you're lying in bed awake for longer than 20 minutes, you don't want to go to bed until you're really tired. So you don't want to be in bed awake. That's one of these kind of cardinal tips of behavioral sleep management. So if you're awake for longer than 20 minutes, get out of bed, go do something else that is low stimulation, low light. Please try to stay off of, screens, just because the light near our eyes triggers our body to think it's daylight and wants us to stay awake, which is the opposite of what we want. So think about all of these types of things. Beds for sleep and sleep only. Get out of bed ideally at the same time each day. If you're feeling like your thoughts are racing overnight, if it's an anxiety issue, think about listening to a meditation that you like, perhaps music, even a podcast that's, relaxing, right? You don't really want to be getting into like mystery novels overnight. And you don't want overnight to be productive either, because then it's incentivizing you to stay awake. So if it's anxiety, the other thing is if it's worries, you write down, keep a little notebook next to your bed, write down worries, try to get them out of your head, because chances are you're not going to solve them overnight anyway, but they'll still be there for you in the morning. Rest assured, worries don't have a habit of going away all that easily, so that you won't forget them. So these are just a few of the tips. Avoid stimulants, avoid caffeine after noon if possible, avoid napping after 3 p.m. because that will decrease your sleep drive. What else? Exercise. We talked a lot about this. Fantastic. Please exercise or move your body in any way possible. Ideally, you want to stop at least 2 hours before bedtime because that can also keep you awake. So there's all sorts of little behavioral tips that you may want to try. If it's waking up to go to the bathroom, you stop, like liquid intake about 3 hours before bedtime. So see what you can do to make some behavioral tweaks. If you have more questions or you want more specialized input or advice, I do encourage you to talk to your physician and they can sort some of the medical issues out. And again, if it's behavioral, you can do this on your own, or you can ask for additional support for cognitive behavioral therapy for insomnia. And Dr. Commander put that acronym in the chat.
Thank you so
In
much.
terms of,
Yes.
yeah, sorry, I'll just say, in terms of dreams, that's tricky. And I'm sorry to hear that's happening. There is a therapy called dream rehearsal therapy, which you kind of walk through a different ending to your dreams. That does take a little more doing and a little more kind of individual attention, but there are ways to get some relief from that.
Thank you for that thorough overview. And I know we've done I'll also send out a recap after this. We've done a webinar on sleep recently, which is really helpful, which probably Dr. Milstein gave that webinar, so thank you. There's another question which I'm happy to take the first stab at, and then maybe let Christian also add his thoughts. But one of our participants is asking sort of what is the mechanism that's causing the fatigue? And there was a slide early on that really showed that this is very multifactorial. So I think, cancer-related fatigue, unfortunately, is the most common symptom that individuals going through cancer treatment experience. So certainly, I'm a breast oncologist. I ask my patients about their energy level at each appointment, and it really is multifactorial. There's so many things, that we need to look at in terms of, this person asked about medications. Chemotherapy is way up there depending on what type of chemotherapy an individual is receiving. Obviously, there are different side effects, but unfortunately, fatigue is a common side effect. Anemia related to the treatment can cause, low energy. So the chemo drugs, radiation, targeted therapy, we have all these new tools in our toolkit, right? Which are great to treat the cancer, but can have adverse side effects. Immunotherapy is still a relatively newer treatment that we can offer, which is amazing in so many ways for treating cancer, but there are many mechanisms by which that treatment can cause fatigue. So there are so many different factors. It's hard to pinpoint exactly what it might be. And then there's all the medical factors too, like is the thyroid level normal? Is there anemia? Is there an infection? So that's why it's a really great question. It's hard to make a specific answer, but certainly I would encourage those who are here, if you are experiencing severe fatigue, to bring it up with your healthcare team so those mechanisms can be explored further. And certainly, Christian, I welcome your thoughts about that as well.
Yeah, I mean, you touched upon everything. I think really it's becoming even more complicated, like you said, with the new tools in the toolbox. And I think we'll probably hopefully know more over time as these things are studied. But yeah, it's really just so individualized. I don't find there's any one thing that I can ever pinpoint or any one mechanism that we can find that can say, oh, if we treat this, the fatigue will get better. I also saw something about 1 month for each month I think it was 1 month for each month of treatment for recovery, and a lot of variation there as well that I've seen. I think there's going to be, we'll never find an exact one mechanism, is my thought on that. And I also saw there was something in the Q&A about psychostimulants, which I think would be good to address. Let's see if I hit answer live.
Yeah, I was just about to go ahead.
Yeah, I was a little bit almost hesitant to include that in part of the presentation, only because, in my experience, it's mostly during active treatment. I find that patients who are really struggling to just get to their day-to-day activities during treatment, it can be effective. And that's where the bulk of the research has been done. It's sort of an off-label use for things like Ritalin. Post-treatment, I have not seen them used. I think it would probably be more of a sort of discussion with your primary care to see if the treatment may have caused other issues that could respond well to psychostimulants. So I think that's going to be very individualized, and there's not going to be a very nailed down role. And there's also there's certain things to consider with psychostimulants. So I would certainly urge you to talk to your primary care or your oncologist at a follow-up visit about something like that. But just keep in mind, I think it's probably going to be more of ruling out other things and seeing if you might benefit from that. Dr. Commander, I don't know if you have anything to add on top of that. but-
No, I definitely agree. Certainly, many of these medications have been studied, and if there were some magic bullet, some amazing medication that really helped with this particular problem, we would of course be recommending that. But it really is individualized, as Christian, as you noted. And I will say, and my favorite medicine, and I know this is a challenge for many on this webinar, but exercise is medicine, as Christian noted, like really the data does support the benefit of physical activity, as we discussed, for helping address cancer-related fatigue. And I know that sounds very overwhelming and very daunting to many people. In fact, why don't we talk a little bit about that? I mean, many people are like, that's not happening. I really can barely make it to the mailbox to get the mail. So Rachel, why don't you share some strategies for how you help coach individuals that try to get a little bit more active, because we know that is so important to help manage the fatigue.
Then get to the mailbox, and that's so good, and that is so good. Yeah, I mean, I think the mantra, if you take nothing else away when it comes to exercise, and I know others have tips too, but yes, more is better than less, and any is better than none, right? We really want to help undo black and white thinking or all or nothing thinking around exercise, right? Exercise can mean a lot of different things, right? So there's physical activity, which is any bodily movement. This is physical activity. Exercise is a structured, structured planned movement with the intention of building fitness. So do activity. Activity could be standing. Activity really can be, tapping your toes, right? It's more is better than less. Any is better than none. So please try to think about it in shades of gray. There's no such thing as perfect in anything, right? And particularly in exercise, so much depends upon what your physical capacity is in that moment, right? And just know that it's not, it'll change over time, and we just want to empower you to feel like you can move your body any way that feels good to you. Any other thoughts on that?
I think that's a really great answer. And I will say there are many resources that you can discuss with your healthcare team about finding ways how you can get a little bit more active, whether that's a referral to physical therapy, or we also have physiatry specialists at the Cancer Center. Physiatry really refers to doctors who specialize in cancer rehabilitation and help individuals learn how to move again after something traumatic, such as a cancer diagnosis and treatment. So there are lots of different resources. There's so many things online now, on YouTube that are free and all kinds. We have actually exercise videos on the Lifestyle Medicine website. So there are so many resources out there, but start small. Again, I love how we started off by walking to the mailbox. That's the first step. And actually, Christian just told us right before this webinar that that's a study you're doing. Do you want to tell the audience a little bit about that? Because it's so interesting and showing how you really want to help pursue this further.
Sure. Yeah. I mean, I am a true believer in that staying active, even during treatment, as much as you can, again, within these shades of gray, is going to be really helpful. And the data definitely supports that. So one of the things that I'm looking at, again, I work in GI cancers, is patients with a new diagnosis of a colon cancer, and looking at how does chemotherapy affect their perceived ability to engage in exercise throughout treatment. Because we can say all we want, hey, you know what really is going to help? Staying active, exercising, doing things that require moving your body. As much as we say that, doesn't mean patients are empowered to do it. And so kind of exploring, what is your self-efficacy? That's our theme, is what do you feel is your perceived ability to do this? And then from there, if we find that, hey, patients on chemotherapy have lower self-perceived abilities to exercise, then what do you do? And I think we get into a lot of these sort of CBT-based approaches, but also individualized. Does someone need physical therapy because they have lower body weakness, because that's just how their chemotherapy is affecting them, or do they have neuropathy that's preventing it, and what other activities can they do? And that's where I say a lot of this is just in conjunction with a multidisciplinary team. I don't think there's any one person as part of a team that can answer all these questions or tell a patient what to do, but I think it's really a topic that's underexplored, but has a lot of potential to help.
Thank you. We look forward to learning more from you in the future about that. So great. So we really also want to give a shout out to our Lifestyle Medicine Clinic, where we do see individuals who are trying to make some changes in their lifestyle, or maybe improve sleep habits or exercise or nutrition. So again, you can ask your oncology healthcare provider to refer you if you're interested in having more of a personalized consultation. So it's already 7:56. The time really flew by. And so I am kind of putting our panelists on the spot, but they're all amazing. So I was wondering if each of you would like to share one final message about cancer-related fatigue. So I don't know, maybe Kristen, I'll let you go first.
Sure, I'll start. Yeah, I think my final sort of takeaway point here is just to be as open and honest with yourself and others as you can be, because as much as there's things you could do, your ability to do them and the ability for these things to improve may be really limited. And so really being gentle with yourself and being open and honest and finding what you value the most is important. And it probably took the bullet points away from Kirsten and Rachel here, but that's the glory of going first, you know. So I will I'll pass it on to them.
I love that. That's great. Rachel, you're next on my screen.
Okay, and then I take the rest of yours, Kirsten. I apologize in advance. I'm gonna echo that self-compassion, right? So, you know, most of us want to be doing so many different things, right? And that's, I know that, you know, somebody put that in the comments themselves, like, look at all the things I want to do on my A days. I can't get to all of them. I need to do one A thing a day. I think it was Lucinda who said that. So thank you. That was an excellent point. Self-compassion, just as Christian. I'm just going to echo that, right? Like, it is frustrating. It's extraordinarily frustrating to not be able to do the things you want to do, and without maybe even like a physical representation of that. The website Kirsten shared was from But You Don't Look Sick, like .org, I think it was, right? I mean, so trying to kind of have to explain that to others can be very, very exhausting in and of itself. So self-compassion and patience is what I would say. Doing even a little bit of what you want to do is marvelous, is what you need to be doing in this moment. I'll pass it on.
Great advice, Kirsten.
Great. Yeah, I mean, echoing, of course, everything that's been said. I think also what comes to mind is that so often we measure ourselves to us at our best, right? And I read something recently that said, you know, we really, you know, after cancer diagnosis, we really should be looking at progress compared to us at our worst. And so every inch forward, every time you do something that you couldn't do when you were at your lowest, that is progress. So I think my message is to redefine what winning looks like, redefine what a good day looks like. And that might be an ever-changing target based on what's going on in your life at that point. So that's what I got.
That's such a beautiful thought to end this webinar with. So thank you so much. Thanks to all of you and to our participants. We're so glad that you joined us. And this is being recorded and it will eventually be on the Mass General Cancer Center YouTube site, hopefully in a week or so. So thank you and have a wonderful rest of your evening.